So what is CLAS? CLAS basically stands for the Culturally Linguistically Appropriate Services, and it was created several years ago by the National Office of Minority Health through the Department of Health and Human Services. And its intention that we're providing quality services for individuals that's going to help ultimately reduce health disparities and achieve health equity. There are 15 action steps that exist to CLAS. CLAS is separated into 3 different entities. It basically offers the blueprint for individuals and health entities and organizations to make sure that your office, you are offering linguistically appropriate services, that you're doing and being in compliance in accordance to the law. There's a lot of changes that have just happened that are affecting all the populations dispersed, those needs of individuals. We cannot always make something that's just blanket approach. We have to in tune to those communities or individuals or people that we're serving. CLAS affords us that opportunity, and it keeps us in compliant. And then if you incorporate it in your policy, it will make you responsible in what we're providing individuals and people. CLAS is about respect and responsiveness. We've talked about that. It's ways to improve quality improvement or services that we provide. If we respect the whole individual and our populations we're serving and we respond to their needs, then we're ultimately fulfilling what CLAS's ultimate things are. So hopefully what you'll learn from your staff or CLAS was gain knowledge about cultural values and beliefs of the people that you're serving. It may not be a patient, you may be in a different type of system, education, different things, whatever services that you're providing to the communities that you're providing, you want to make sure that you're adapting your services to that. You want to interact effectively with people whose cultures and beliefs are different than your own. So there's a lot of different things that I've had the opportunity to be exposed to, and there's just opportunities that you get a chance to do when you meet and learn and observe other cultural practices from people. You want to provide quality care that's respectful, not judgmental. We want to make sure that the services that support our primary languages, because we're having a language deficit. And what we do, I know I just talked to the Minority Health Partners meeting I was just in, and we were talking about those languages that were being used during COVID response. The highest being Spanish, but you have Burmese, you have Creole, you even have Arabic and different things. So it's important to know the communities that you're serving and what you may need to get information translated into so you can better serve the communities. And then finding out those cultural differences that are probably going to need to be addressed. So the first principal standard is the general standard of CLAS. Going into our CLAS standards, principle number 1, it says, you want to provide effective, equitable, understandable, respectful quality of care and services that are responsive for our cultural health beliefs, our practices. This is the general overall premise of what CLAS is. The other ones are going to get into governance, communication, and execution, but this is the general principle standard of what CLAS embodies. The next 3 stanzas or the next 3 objectives for CLAS is under governance, leadership, and workforce, meaning in regards to how we're going to advance our governance as far as our policy, our leadership, how we're going to promote CLAS, how are you going to recruit and promote and support cultural and linguistic diverse governance. Does your agency, entity, program reflect the people that you're serving? Do you have people on your boards? Do you have people in the planning efforts that you're doing for programming? And then educating and training the governance. It's a constant. We are always continuous learning. The only time that you have learned everything and arrived is when we have left here on this earth. And so we are constantly learning each and every day. Going to our next portion is our communication and language assistance. And so again, like I said, we have a language deficit in regards to we need to provide the necessary languages. And also we want to do in communication, not just language, we want to remember those that may have certain disabilities, such as being blind or deaf or hard of hearing. So we may want to provide ASL services, things in Braille and different things. So we want to make sure that we're offering the assistance to individuals who are limited English proficient or have other communication needs. We want to make sure, number 6, we're informing individuals of their availability of language services. I mean, if I come to you and I speak a different language, I'm going to probably, especially in a health situation, speak my first language because that's the most comfortable for me. That's what I'm most familiar with. And if I'm sick, injured, or have a problem, or they need behavioral health services or dealing with the issue in regards to where I am being unjustly dealt with because of what I believe or sex or gender or different things like that, then I'm going to speak what is most comfortable for me. So we want to make sure that we're ensuring we are giving people the necessary language assistance that they need. We want to provide easy to understand print. We don't have to use these wonderful big $20 words just to simply say, I'm here to help you. So we want to make sure that our communication and language assistance is clear. The next couple of stanzas, which is going to lead, because there's 15, is going to lead, is engagement, continuous improvement, and accountability. We have to be accountable for the things we do. We have to be accountable for our staff, and we have to realize that what we do has an indelible impact in the communities and the people we serve. So if we're establishing culturally linguistically appropriate services and policies, we're being accountable, we're transparent to the people we serve, we're going to be very successful in our planning efforts. If we involve the community in the beginning, when we are doing planning and programming or research and different things, rather than making people an afterthought, it's going to be very important. And we're going to have to do some tough things in regards to if we are accountable and someone that's in our staff is egregious and offends or does something that is unlawful. We're going to have to figure out a corrective action plan, and I think that comes a little later. But we want to conduct ongoing assessments of our organization. We want to make sure that we're right. We have to do a self-assessment as well as an organization assessment. We want to make sure that we're collecting and maintaining accurate, reliable demographic information, and that is something that we're working on at the state, where we're constantly trying to improve our data collection efforts, even in trying to incorporate different things as far as where we can do as far as gender, what we can do in regards to subpopulations for certain racial and ethnic groups. So we're trying to make sure that we are growing in that way of how society and our environment is going. We want to collect and maintain accurate, reliable demographic data, not just because we just want to collect the numbers, but it helps us. Data makes the world go round. Data helps us get our resources and money. Data helps us to show specifically who we're serving and what we need to do as far as making changes. Continuing on with our engagement and continuous improvement, we want to make sure that not only do we collect these regular assessments internally, but also how are we doing to the people that we serve? The plans, the services, and different things. We want to check in to make sure that, hey, what our original intent, has that changed? Because such as our environment change, our community could have changed. The policy could have changed. Politics changed. There's a chance and a possibility everything that we have worked for towards, let's say, the opiate epidemic and different things that our governor was a proponent of could change if we got a new incoming governor, because simply they would have a different agenda. So how are we working with that? Because even on the city level, county level, what's going on with aldermen and councilmen and different things like that that may affect communities that we're in. What's happening if somebody is across the street from Marion County, but this Hamilton County and the services is over there, but I can only do it over here. How do we handle those different things? We want to make sure, like I had mentioned before, that we create a conflict and grievance resolution process. How are we going to handle those tough situations? And then lastly, we want to make sure that we're continuing to progress. We want to tell the good things that we're doing, the bad struggles that we may have had, and how we're overcoming that. So that's what's going to afford us the opportunity. So again, if you remember nothing else that I talked about today, CLAS helps make sure service is respectful. It makes your services understandable. It definitely makes your service is more effective, and CLAS initially helps us to get to equitable solution.